Everyone tells you Christopher Brennan was a lovely boy. When he was little, he'd amuse the family with his songs and sense of fun. Later, he'd make them proud.
He was in the St John's ambulance. He'd done plenty of duties with them.
Up early, out early, and he would have done it all day if he was allowed to.
He boxed as well?
Yeah, that used to help him when he wasn't feeling very well. He'd go and sort of have a boxing session with his dad.
It made him get rid of the tension and...
Help with the voices.
Help with the voices, yeah.
Christopher's mental illness, the voices, arrived when he was 13 and never really went away. They made him hurt himself.
So he'd swallow things?
Yeah, that was his way of self-harming.
To swallow?
Yeah, batteries, coins, bottle tops.
On July the 23rd last year, Christopher Brennan's parents asked that he be admitted to the Royal Bethlehem Psychiatric Hospital here in Beckenham. 5 weeks later, while a patient at the hospital, he killed himself.
Christopher died after swallowing a deodorant top wrapped in tissue. So how was that allowed to happen in what's supposedly a place of safety? The Brennans are dismayed there's no legal requirement for any independent inquiry. The legal campaign inquests say it's a real problem. Coroners looking into self-inflicted deaths in psychiatric hospitals are heavily reliant on internal inquiries set up by the hospital's management.
If a child dies in a child prison, there would be an independent investigation carried out by the Prisons and Probation Ombudsman, and I find it deeply worrying that the death of a vulnerable child who is being looked after in a mental health setting is not afforded the rigorous independent investigations that would be carried out in any other setting.
Tomorrow, Inquest releases a report calling on the Department of Health to publish the figures on self-inflicted deaths. Using data from academics and an independent panel, the report estimates there are an average of 132 such deaths every year in mental health units. That's between 2 and 3 a week. As for children...
The Inquest are working on 4 deaths of children, which is a disturbing number in any event, but I worry that the true picture of deaths and serious incidents in mental health settings are being obscured and hidden from public scrutiny.
It's a disturbing picture, young people ending their own lives while in psychiatric care. And away from the Christopher Brennan case, there are serious concerns about how and where some of these youngsters, children, are being treated. Faced with an acute shortage of psychiatric beds, some, when they're most vulnerable, are being sent away from their families across the country to private hospitals.
Psychiatric bed closures have led the NHS to spend tens of millions more every year sending patients to private hospitals. They're often long distances away from the eyes of their families. Soon an inquest will hear of Sarah Green, a 17-year-old who died in the Priory, Manchester, 200 miles from her home in Scunthorpe. Later, a coroner in Hastings will hear how Amy Alcaria, a 14-year-old from West London, died in the Priory Hospital in East Sussex.
Thank you.
This is Amy, aged 11, happy on her sister's 21st. And here's Amy, same day, truculent.
Yeah, I didn't do it!
She was a volatile child, loved, loving, but always troubled.
She was diagnosed with having ADHD, OCD, conduct disorder and Tourette's.
That's a lot to be getting on with, isn't it?
Oh yeah, that was just at the start.
In adolescence, Amy's problems grew worse. She wanted to be a boy.
I went and had her hair cut specially, so like at a barber's.
The tantrums increased. Special schools couldn't cope. In 2012, she was expelled from a special school, not for the first time. From her home in Hounslow, the Health Trust sent her to the Priory, 90 miles away.
You don't question these things. I do now, but you didn't then. You put your trust in these people.
When a child's prone to self-harm, it's important their environment is kept tidy, clear of risk. A close family friend says when he collected Amy from the Priory for weekends at home, he was shocked by the state of her room.
Both times that we went there, it was a complete and utter mess. Clothes everywhere, rubbish all over the place.
In her room?
In the room.
Were you surprised?
Yeah. Especially considering it's classed as a private hospital for the kids with mental health. You don't expect to walk in and see a child's room like that, especially if they're on suicide watch. You'd expect it to be completely clear.
After Amy had been in the Priory 10 weeks, her mother got the call she dreaded.
On the 12th, at 11 o'clock at night, that's when our life changed completely.
You got a phone call saying that she...
From Ticehurst Priory, from one of the staff there. We didn't get it, and it was, oh God, I don't know how to say this. Amy was found with a ligature.
The family say she'd strangled herself with a scarf, and it had been there in the room when Luke took his photos 2 weeks earlier.
I didn't notice the scarf until we had put the photos on the computer, and then it was only where it was on a bigger screen that we saw the scarf.
And that was the same scarf?
Same scarf.
The family's lawyer says they've many questions.
Yes, there are concerns from the records that we've seen about the levels of observation, the adequacy of those observations, risk assessments, care and treatment, contact with Amy's family about restraints that occurred and self-harm incidents that occurred. There appears to have been a real lack of communication with the family, and whether or not if this had have been adequately dealt with, whether or not Amy's death could have been avoided.
Could any of these deaths have been avoided? With inquests sometimes delayed for several years, it's a question campaigners say will only be answered by independent inquiries. Bereaved parents, meanwhile, are left with their grief and their final, aching goodbyes.
I should have known, because Chrissy never ever said goodnight on the phone. It's always see you later or see you tomorrow, doll. And then 2 hours later, we got the phone call.